I'm excited to present to the international community this osteopathy online course entitled Cranial Techniques and Advanced Treatment Protocols in Pediatric Osteopathy. My name is Maureen Hannah Mahar. I'm the founder and educational director for the Center for Continuing Education of Osteopathy, and I'm the author of this course. I've been treating newborns for over 15 years, and I've been recruited to do so throughout the world, from places as far flung as Singapore to Northern Ontario among the Amish community. And I've noticed one thing is always the same. Mothers are distressed and they want their babies to be able to grow up healthy and happy and be able to heal. This is when conventional allopathic medicine is not enough, and it's time for us as pediatric osteopaths to step in. So what will you do? How can you know if a cranial abnormality at birth is the cause of colic or reflux or sleeplessness or digestive disturbances or even an inability to latch and feed? Well, this course will teach you all of that. You'll learn how to identify the developmental milestones that babies go through from birth to 5 years of age so that you can know if this baby is on track, healthy, or if they need your intervention or not. And the wonderful thing about pediatric osteopathy is if it's done well and it's indicated, it actually requires very few treatments. We've designed this course in a way that you will learn first the etiology of abnormalities that are commonly found in newborns in clinical settings, followed by video demonstrations of step-by-step treatment protocols in how to resolve some of the most common conditions that you'll see in a clinic, such as how to perform a clinical assessment from A to Z, how to perform cranial molding techniques in order to be able to relieve cranial abnormalities at birth. Third, how to treat digestive disturbances such as colic and reflux. Fourth, how to resolve latching and feeding difficulties so that breastfeeding mothers can do it happily and comfortably. And most importantly, how to resolve orthopedic conditions such as cervical torticollis, shoulder dystocia, and lower limb abnormalities. So how does this online course work? Well, first you should know it's worth 20 professional development or CEU credits, and it's set up to run over 8 weeks, with one chapter being released each week, which means that you have 8 weeks, 8 chapters, but you have an additional 4 weeks at the end of the course to be able to review any of the material you wish to review or submit any of the homework assignments that will need to be done in order to achieve your certificate of completion. So in fact, even though the course runs for 8 weeks or 2 months, you have a full 3 months to be able to access the course. It will be a learning experience that's designed for the visual learner as well as the auditory learner. Each chapter will contain text with explanation of each condition, the etiology, the cause, the biomechanic explanation coming from medical sources of what's happening with a condition and how we need to go about treating it. Next, you'll see me doing demonstrations of each individual technique of a treatment protocol for that particular condition on an anatomically correct doll like this, so that we can get in up close and show you exactly where sutures are located, where on the sternum your hand needs to be, so that you'll be able to see very closely and in detail how the technique can be performed, and you'll be able to go back and watch this as many times as you want. Then the chapter will end with me performing a full treatment protocol of each one of those techniques on a newborn baby. We've found from feedback from osteopaths throughout the world that this incremental approach to learning really helps drive the point home and makes learning enjoyable and allows you to be able to walk away from the course feeling confident that you've integrated what we've shown you, not just in your mind, but also with your hands and then also in your clinic. So now that you know what you're going to get in the course, let's talk about why now is a really good and almost crucial time to learn pediatric osteopathy. Well, first of all, the demand for highly trained and highly qualified and knowledgeable pediatric osteopaths far outweighs the supply. I myself, having been asked to travel to remote communities because there was no one in the area who knew how to help moms treat their babies, is proof of that. The demand is growing. we need to fill that demand. And it's part of my vision to be able to bring that knowledge, all my years of experience to the world so that all babies can grow up healthy and strong. Secondly, in many countries, pediatric osteopathy, or the cranial aspect of pediatric osteopathy, is not even taught as the basic part of their curriculum. So osteopaths are graduating from college not even knowing how to treat newborns. There's a void in the educational system. And when I put together this course, my goal and my aim was to fill that void, because newborns need to be treated just as much as adults do. Thirdly, there's a growing trend within certain countries whereby legislation might be passed or governing bodies will dictate that you need to have specific training or specific credentials in order to be able to treat newborn babies. So it's important, I believe, now to get that knowledge and experience under your belt before that time comes, if it does. Being asked to travel to remote areas in order to help newborns where there was no other practitioner or osteopath in the area who could help was demanding, but it's satisfying in a way that no other patient population will challenge you or satisfy you. You will feel that you're working with God in order to be able to help a new life that has come into this world have a fighting chance to be able to grow up healthy and happy and strong. Become that person. Join us in this new online exciting course and become a pediatric osteopath.